Mr. Norman,
Um,
do you prefer Dex or Mr. Norman?
Dex, please.
Okay. Dex, it's nice to meet you. My name is Katharine Norman. I'm the student nurse practitioner that will be taking care of you today. Now, before we begin, I would just like to remind you that everything we discuss here today is confidential and will not be shared without your permission.
Appreciate that.
Certainly. So I want to make sure that we have the correct information for you.
Okay.
Dex, how old are you?
28.
Okay. And what race do you identify with?
White.
And what gender?
Male.
Okay. And Dex, are you married?
I am.
Okay. At what age were you married?
Let's see, married a couple years, about 26.
Okay. And Dex, what do you do for a living?
Stockbroker at TD Ameritrade.
All right. And how did you hear about our clinic?
Just on the internet, just closest one to my house.
Okay. Now let's talk more about you. What brings you in today?
I hurt my ankle playing soccer.
Okay. And it looks like your right ankle?
Yeah, it's still a little swollen.
Okay. And where on your ankle does it hurt?
Right here on the outside.
All right. And when did the pain first begin?
I actually twisted my ankle playing in that game, so pretty immediately after.
Okay. How long ago was the game?
Just a couple days.
A couple days. So about 2 to 3 days ago.
Exactly.
Okay. And did the pain come on suddenly or slowly?
Suddenly.
And does the pain stay in that area? Do you feel it in your leg or your knee at all?
No, just in the ankle.
Okay, not in your foot?
No.
Okay. And how would you describe the pain?
It's like kind of like a stabbing pain whenever I put pressure on it.
And what makes it worse?
Just putting pressure on it.
Okay. Putting pressure on it, are you able to walk?
Barely. Not over there. Put pressure on it hurts.
Okay. And has anything made your pain better?
Just been taking ibuprofen.
Ibuprofen. What dosage of ibuprofen have you been taking?
I believe it's about 400 milligrams.
Okay. And how often have you been using ibuprofen to help with the pain?
About every 4 hours or so.
Okay.
Just a recommended dose.
And when was your last dose?
Just a couple hours ago.
Okay. Would you say it's been less than 4?
Probably.
Okay, so that would be around what time?
I think it was around 2.
2, okay. Okay. And other than the ibuprofen, does anything else make it better?
Just ice, I guess.
Nice.
Numbs it.
Okay. And have you noticed it hurting worse at any particular time of the day?
No.
And on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, what would you rate your pain at right now?
Since I took ibuprofen, probably about a 4.
A 4. When the ibuprofen wears off, what is your pain at?
Kind of like, I guess, a 7-ish.
7. Okay. And what's an acceptable pain level for you?
I'd like to be, well, acceptable, I guess, 2, 3.
Between 2 to 3. And are you experiencing any other symptoms?
No.
Okay. I'd like to find out a little bit more about you. Are you taking any medications currently?
No.
Okay. Any prescription medication or over the counter?
Just the ibuprofen.
Just the ibuprofen. All right. And any vitamins or herbal supplements?
I take a multivitamin, like a 1 a day.
Okay. A 1 a day, is that a men's multivitamin or?
Yeah, just a men's multivitamin. I'm not sure of the brand.
Okay. And do you have any medication allergies?
No.
No. Any food allergies?
Mm.
Okay. And any allergies to dust, pollen, or mold?
No.
Okay. And are you allergic to animals?
No.
And any latex allergy?
No.
Okay. Dex, are you sexually active?
I am.
And what is your method of birth control?
Just natural family planning.
Okay. Now, for some of your past immunizations, have you received the MMR vaccine?
Yes.
Pertussis?
Yes.
Polio?
Mm-hmm.
Hepatitis A?
I believe so.
Hepatitis B?
Yes.
Varicella zoster, excuse me.
Mm-hmm.
Meningococcal?
Yes.
Smallpox?
Yes.
And HPV?
No, not that one.
Okay. And when was your last tetanus shot?
I think it was a couple years ago.
Okay. Can you give me a guesstimate of how many years? Was it less than 5, greater than 5?
It's just a couple years ago.
Okay.
No, 2.
And have you received a flu shot this year?
No.
Have you gotten flu shots before?
No.
And what is your reason for not having gotten a flu shot in the past?
Not a fan of needles.
Okay.
Prefer only get shots when I have to.
All right. And have you had a TB skin test?
No.
Have you ever received a pneumonia vaccine?
I don't believe so.
Okay. And when was your last physical?
Also a couple years ago.
A couple of years ago. Okay. So that would be about 2015.
Yes.
And how would you describe your mental and emotional health?
Good condition. Good condition.
All right. And have you ever been diagnosed with a mood disorder or psychiatric condition?
No.
As a child, have you ever had measles,
No, I don't believe so.
mumps,
No.
rubella,
No.
pertussis, it's otherwise known as whooping cough,
No.
chickenpox?
Yes.
Okay. At what age were you when you had chickenpox?
I believe it was about 5 years old.
About 5. And have you ever had rheumatic fever,
No.
diphtheria, or polio?
No.
And have you ever been diagnosed with asthma?
No.
Okay. And do you have any medical conditions?
No.
Okay. Have you ever received a diagnosis of cancer?
No.
Of coronary artery disease or high blood pressure?
No.
Any thyroid disorders or diabetes?
No.
Any sexually transmitted infections or tuberculosis?
No.
Hepatitis or chronic obstructive pulmonary disease?
No.
You might have also heard that one as COPD. Have you ever been hospitalized?
No.
Any surgeries of any kind?
No. I'm pretty lucky.
That is. And any prior accident or past injuries?
No. Just,
Okay.
yeah.
Oh, go
Just
ahead.
just some minor ones. It's sorry here and there, but nothing major.
Some minor ones. Okay. Were those
Bumps and
involving your
bruises.
ankles or?
Yeah, but just a normal little sprain, nothing special.
Okay. Anything to that right ankle in the past? Any bone injuries?
No bone injuries.
Okay. And how about muscle injuries?
No.
No? Just like you said, some bumps and bruises?
Mm.
Okay. And do you have any disabilities?
No.
And have you ever received a blood transfusion?
No.
Okay. I'd like to learn a little bit more about your parents and grandparents and your family. Next, are both your parents living?
Yes.
Okay. And what are their ages?
I believe my mom is 54. I believe my dad is 55.
Okay. And does your mother have any health conditions that you know of?
No.
And how about your father?
Just high blood pressure, I believe.
Okay. Now, on your father's side, your grandparents, are they both still living?
My grandmother is. Unfortunately, my grandfather passed.
I'm sorry to hear that.
It's okay.
Now, tell me, how old is your grandmother?
I believe she's 86.
Okay. And does she have any health conditions?
Not to my knowledge.
Okay. And you said your grandfather passed away.
Mhm.
What age was he when he passed?
I believe he was only 50 years old.
Only 50. Okay. And what was the cause of his death?
Heart attack.
Heart attack. Did he have any previous heart history?
If he did, I didn't know about it.
Okay. And any other health conditions for your grandfather?
No.
Now, how about your mother's parents, your maternal grandparents? Are they both still living?
Unfortunately, both of them passed away.
Okay. Well, thank you for sharing that.
Of course.
What are their ages?
I believe they passed. My grandmother passed away at 85.
85.
Mm-hmm.
Okay. And what was her cause of death?
Pancreatic cancer.
Okay. Did she have any other health conditions?
No.
And how about your grandfather?
He passed away at 86 of heart disease or heart attack.
Okay. And did he have any prior heart history?
I believe he had, I think a bypass put in when he was 70, if I remember correctly.
Bypass at 7?
Yeah, it was hard.
Okay. And do you have any siblings, brothers or sisters?
2 sisters.
2 sisters. And what are their ages?
My sister, one of my sisters is a couple of years younger, so it means she's 26, and the other one's 20.
26 and 20. And Dex, do your sisters have any health conditions?
No.
No. And do you have any children?
I do. Don't.
Okay. Now a little more about you. Where were you born?
Born in White Plains, New York.
Okay. And at what age did you come here to Texas?
I believe it was in junior high, so 13, 14, somewhere in there, 11, 12. I don't remember exactly.
Okay. And where do you currently reside?
In Bedford, Texas.
In Bedford. And do you live in a home, an apartment?
It's a home.
Is it a two-story home?
No, just a home.
Okay. And do you have any stairs in your home?
No.
Okay. Do you know what year your house was built?
1979.
All right. And what is the highest level of school that you've completed?
I have my bachelor's.
Okay. And what did you major in?
Mechanical engineering.
Oh, wow. Okay. Now, you previously said that your job is at TD Ameritrade as a stockbroker.
Mm-hmm.
Are you exposed to any heavy lifting at work?
No.
Okay. Any chemicals or environmental hazards?
No.
And any loud noises?
No.
Okay. Now, earlier you mentioned you were sexually active. Any history of sexually transmitted infections?
No.
Okay. And do you smoke?
No.
Have you smoked before?
Mm-hmm.
Okay. And do you use tobacco of any kind?
No.
And do you drink alcohol?
Occasionally.
Okay. About how many glasses would you say you have a week?
Probably like 1 to 2 glasses of whiskey.
Okay.
And then I guess like maybe a glass of wine a month.
Okay. And have you ever done drugs?
No.
Okay. Have you ever smoked pot or done cocaine, heroin, or LSD?
No.
And what hobbies do you have?
I like to play soccer and work out at the gym.
Okay. About how often would you say that you work out?
Probably at least 3 or 4 times a week.
3 or 4 times a week?
Mm-hmm. And usually to get at least half hour to an hour, I guess.
Okay, half hour to an hour.
Mm-hmm.
Well, that's great. That'll definitely help keep your heart healthy.
Trying.
I understand. Any dietary restrictions?
No.
Okay. And how would you describe your diet?
It's pretty well rounded and trying to get healthy, I guess.
Okay. And are you currently or have you ever been involved in the military?
No.
Okay. Now, currently, have you experienced a fever in the past few days?
No.
Any chills or night sweats?
Mm-mm.
Okay. And any changes in your sleeping patterns or recent weight changes?
No.
Okay. Have you noticed any skin rashes or abnormal hair growth?
No.
Okay. And have you had any skin color changes or abnormalities of your hair or nails?
No.
Okay. And do you get frequent or unusual headaches?
No.
Have you ever had any concussions or lost consciousness?
No.
Do you have vision problems such as blurred vision or dry eyes?
Mm-mm. No.
And do you have hearing loss?
No.
Any drainage from your ears or ringing in your ears?
No.
Do you ever get dizzy?
No.
Okay. Do you have frequent nosebleeds, frequent colds, or any nose pain?
No.
All right. And have you noticed any changes in taste or any bleeding in your mouth or gums?
No.
No. And any voice changes?
No.
And have you noticed any lumps in your chest area? Could be around your nipples and that breast tissue area, any lumps or any discharge?
No.
Okay. And do you have any pain with breathing?
No.
Any wheezing or frequent coughing?
No.
And have you ever been exposed to tuberculosis?
No.
All right. And are you currently experiencing any chest pain?
No.
Have you experienced any chest pain in the past?
No.
Do you have high blood pressure?
No.
And have you ever suffered from a heart attack?
No.
Okay. And you mentioned you try to eat a pretty well-rounded meal. How is your appetite?
It's good.
Okay. And do you have heartburn or indigestion, nausea, or any difficulty swallowing?
No.
And how often do you have bowel movements?
At least once a day.
Once a day? And have you noticed any blood in your bowel movements or any black, tarry color?
No.
And do you have constipation or diarrhea?
No.
And any previous gallstones or ulcers?
No.
Have you experienced any pain with urination?
No.
And have you noticed any change in your urination patterns, such as going more often than usual?
No.
Okay. And what color is your urine?
No, it's not pretty clear.
Clear. And have you noticed any unusual odors?
No.
Okay. Have you noticed any changes in your sex drive?
No.
And have you experienced any testicular pain or abnormal discharge?
No.
Okay. And do you have difficulty getting or maintaining an erection?
No.
Okay. And any difficulty with ejaculation?
No.
Okay. Do you suffer from any joint stiffness?
No.
Do you have any difficulty with movement or any weakness or paralysis?
No.
Okay. And have you ever fainted or felt unusually dizzy?
No.
And have you experienced seizures of any kind or any memory issues?
No.
All right. And have you noticed any changes in your lymph nodes, such as tenderness or enlargement? Most of them, they can be concentrated around here. You might feel any head pain.
No.
Okay. And have you noticed any unusual bruising or bleeding?
No.
And have you ever been told that you have a blood clot?
No.
Okay. Have you ever been diagnosed with diabetes?
No.
Have you ever experienced an increase in thirst?
No.
And have you been unusually susceptible to hot or cold temperatures or had any unexplained weight changes?
No.
And have you noticed any changes in your mood or any difficulty concentrating?
No.
Have you been feeling sad or depressed?
No.
Okay. Have you had any thoughts of taking your own life?
Definitely not.
And have you felt worried or anxious?
No.
Okay, Dex, well, I know that was a lot. I appreciate it. Is there anything that I may have missed or anything else that you would like to share with me before we move on?
No, I think that's pretty comprehensive.
Okay, well, thank you so much for your time.
You're very welcome. Thank you.